The CDC has issued a report on the bacteria Cryptosporidium. This does not mean that you can't enjoy the pool this summer with your friends. Because the pool-loving parasite Cryptosporidium, crypto, on the rise, you are probably wondering if you should skip the pool for the summer. If you happen to swallow a bit of pool water that's contaminated with crypto, you could have watery diarrhea for up to 3 weeks. The good news is that you don't have to call off your pool party. But you may want to take special precautions before you jump into the deep end. According to the Centers for Disease Control and Prevention (CDC), between 2009 and 2017, researchers identified 444 outbreaks resulting in 7,465 cases of cryptosporidiosis, which is the illness that's triggered by the parasite. The number of cryptosporidiosis outbreaks has grew by about 13% each year, according to the report. 35% of the outbreaks were linked to water playgrounds and pools. The rest of them were caused by contact with infected cattle, exposure to infected children in childcare settings, and consuming contaminated foods like unpasteurized milk or apple cider. Majority of cases occurred during the peak summer months of July and August. The number of treated recreational water-associated outbreaks caused by Cryptosporidium drives the summer seasonal peak in both waterborne cryptosporidiosis outbreaks and cryptosporidiosis outbreaks overall. Here's why pool water is a crypto hotspot. Crypto spreads through fecal matter that is infected from people and animals. If a swimmer happens to be infected and excretes a bit into a pool, another person could accidentally gulp down some pool water and end up with a case of cryptosporidiosis. It does not take much for an infected person to cause a full-blown outbreak. The parasite can be protected in contained shells or cysts that spread from person to person. A person who is infected can release cysts at much higher levels than the amount required to cause an infection. This means that just a few cysts of the tens of thousands released or excreted by a single person can be enough to generate an infection in any person. You would think that chlorine would be able to kill the parasite, but that's not the case. Crypto can survive in treated pool water for several days. It can also survive on surfaces that have been disinfected with chlorine bleach. The cyst is not impacted by chlorine, the chemical just doesn't have a negative effect on it. Because of this, it's extremely difficult to remove crypto from a pool once it's already there. Symptoms may last up to 3 weeks. Cryptosporidiosis causes intense, watery diarrhea for up to 3 weeks. Some may also experience abdominal cramps, nausea, vomiting, low-grade fever, and loss of appetite. Healthy adults usually recover on their own within about 1 or 2 weeks. Children are most at risk because they're the ones typically gulping down splashes of pool water. In general, young children, as well as those with a weaker immune system, may experience a rockier course. Children, along with pregnant women and immunocompromised individuals, should receive a lot of fluid if they get sick, as they're more likely to become dehydrated. A doctor could treat them with oral or IV fluids to help replace lost electrolytes. They may also prescribe medications to reduce the duration of the diarrhea, Glatter added. Here's how to stay safe. First and foremost, don't swim if you have diarrhea. Even if you had diarrhea anytime in the past 2 weeks, it's best to avoid going in a pool for now. Try your best not to swallow water from pools or untreated bodies of water, like lakes, rivers, and ponds. If you have kids, take them to the restroom frequently and check your infant's diapers every hour or so. If you or a loved one has had diarrhea, be sure to wipe and rinse off thoroughly and always wash your hands. Soap may be able to disrupt the structure of the parasite, and hand washing also serves to mechanically remove the parasite from one's hands. Lastly, before heading to your local swimming place, do a quick search online for the pool's health grade. If you can't find that information, you can always use your own test kits to measure the pool's chlorine and pH levels. If you thought this information was useful, don't forget to subscribe to the channel, leave a like and comment a topic you would like me to make a video about.